Good afternoon, and perhaps good evening, depending on where you are in the world. Welcome again to Montgomery Heart and Wellness, Dr. Montgomery's Clinical Pearls. And as many of you who are subscribers to our show know, I've been keeping up with the issue with Jamie Foxx. And we've heard some great news recently. We've heard that he's out of the acute care hospital, and there are reports of him being in a rehab facility. Many of you may know that his daughter did report on him being playing pickleball the other day, which is quite interesting. But we were getting some concerning news, but this was as recent as a day or two ago. This came across my news feed, and I thought it'd be interesting to talk about not only this update, but the whole issue of rehab. According to the report, he was seen at a rehab facility, but this particular rehab facility specializes in individuals who suffered from stroke, spinal trauma, and traumatic brain injury. So there's some, continuity or consistency with this report and some of the earlier reports of Jamie Foxx having had a stroke. Although none of that's been confirmed, even this report hasn't been confirmed. But I thought it'd be worthwhile coming on and sharing with you some information about recovery from a stroke, but also the whole concept of rehab. As all of you know, I try to give you a broad scope of information to help these, news headlines apply to your life. It's my pleasure to bring on a friend and colleague of mine, Dr. Scott Stoll. Dr. Stoll, who is a specialist in physical medicine rehab. He's also the co-founder of the Plantrition Project, the International Plant-Based Nutrition Healthcare Conference, and the International Journal of Disease Reversal and Prevention, and the Regenerative Health Institute. It's a unique collaborative project with the Rodale Institute that integrates the regenerative vision for human health, agriculture, and the environment. He's a member of the Google Food Lab, serves on the advisory board of Whole Foods for the healthcare clinics, and served as a member of the Whole Foods Scientific and Medical Advisory Board. Dr. Stoll is a chairman and the board of the Plantrition Project. Every year, he hosts a very popular one-week health immersion, Dr. Stoll's Total Health Immersion in Naples, Florida, and helps attendees restore and optimize their health, overcome addictions, and develop sustainable regenerative lifestyles. In addition to authoring several books, including Your Next Bite, and the numerous scientific articles, Dr. Stoll has appeared on national shows, including the Dr. Oz Show, hosted in 2018, PBS special Food as Medicine, and numerous documentaries, including Eat to Live, Eat You Live, Wait Till It's Free, The Game Changers, as well as being a published author and member of the 1994 Olympic bobsled team. He is highly sought after international speaker. Dr. Stoll and his family live in Bethlehem, Pennsylvania. So without further ado, I'd like to welcome Dr. Stoll. Scott, welcome to the show.
Hey, thank you, Baxter.
Thanks for coming on. Here. Yeah, this issue, and I'm not sure if you've kept up with it very much, related to Jamie Foxx, the reports of whether he's had a stroke, but clearly there's a report of a hospitalization, an acute medical emergency. And then now the recent report of him being in a rehab facility, and that rehab facility being specialized for individuals recovering from stroke and spinal trauma and traumatic brain injury. Let me just get your general comments on that. I don't know if you kept up with the news story, but what do you make of that information first and foremost?
Yeah, thanks. And certainly, this has been shrouded in some mystery, and there have been a lot of false reports going around about Jamie's health and where he is and his condition. But I think that, first, the more recent reports that he's improving, perhaps even playing pickleball, is great news for Jamie and his family and all the people that love him. And so, I'm thrilled to hear that he's recovering, regaining some function, and I know it's an answer to lots of prayers. And so that's the good news. What we really don't know still is exactly what happened to him, but based upon the reports that we have available, something significant happened that dramatically impacted his life to the point where he was, hospitalized and had to go to a rehabilitation facility. And then based upon the reports that he's been in a facility that specializes in stroke and traumatic brain injury and spinal cord injury, the kind of hospitals where I did part of my residency, we can assume it was a substantial injury that required intensive rehabilitation by a dedicated team. And this type of a rehab setting is really reserved for somebody that has suffered a significant injury that is not able to go home and live independently, and that requires some intensive rehabilitation, re-education, and training before they go home in order to maximize their quality of life.
Wow, wow. Well, that says a lot. What I want to do is get into some of the background concepts of physical medicine rehab. And so, what we want to do in this next section is now that you set the stage so eloquently regarding the issue with Jamie Foxx and what the possibilities are, I'd like us to get into the concept of physical medicine rehab. But before we do that, I'd like for those of you who are looking live now, please give us a thumbs up. If you are new to the channel, please subscribe and hit the notification button. And of course, please share this information. I think this is going to be very important information for the general public to know, but I'm certain that you have loved ones who are who would benefit from this information greatly. So I would like to start with a broad question. The whole issue of physical medicine rehab, many people don't know what that specialty is. Many people don't know that there are doctors who specialize in this area, and that's a broad area. Can you just educate us on that briefly?
Yeah, certainly. I didn't discover this area of medicine until my fourth year of medical school, as I was trying to decide, do I go into surgery? And somebody directed me to physical medicine rehabilitation, and it was a perfect fit with my philosophy. Physical medicine rehabilitation has kind of two arms, and it's really a specialty that focuses on working with a team to improve the quality of someone's life. One of the sayings that's part of physical medicine rehabilitation is that we add life to people's years and years to people's life. And so it's this kind of this beautiful, elegant use of healthcare to really add quality to someone's life. Part of our training in spinal cord rehabilitation, stroke injury, traumatic brain injury, amputee, and major medical issues where someone requires, maybe years of rehabilitation after an accident. The other part of our training is in musculoskeletal medicine, but still with the same bent of looking for root causes and then trying to regenerate tissue, restore function, and return the body back to its best optimized condition at that point so that people can move forward. And I think that, this training has really shaped even my approach toward lifestyle medicine and plant-based nutrition, because it's all kind of geared to the same thing that you and I do every day, which is how can we treat the root cause? How can we restore, regenerate, and return function? And how can we maximize the quality of life for someone?
Wow. I'm glad you broke that down to those two areas, because I never thought of it that way. And it feeds into the next question, is the general indication for rehab, obviously a stroke, an injury, etc. But if you can kind of outline that for us to a certain extent, the general indication for rehab, inpatient versus outpatient, what are some of the list of things that we should think of regarding someone who needs rehab in the event that someone has a loved one has a disability and they're not getting rehab and they're not aware of this?
Right. No, that's a great question. And I think after, being involved in this field for a number of years, I've come to realize that more of us may need a little more rehabilitation than we realize. So, regarding the inpatient rehabilitation, it's decided on oftentimes by the physician and physical occupational speech therapist that somebody may not be safe to go home. They may not be able to manage their activities of daily living. They may be a fall risk. They may have difficulty swallowing food and be a risk for aspiration. And so, based on some of those criteria of safety at home and ability to take care of themselves, in addition to screening the environment in which they're returning, do they have support at home? Are they going to be alone? Those are kind of the internal determinations on whether or not somebody leaves the hospital and goes to an acute rehabilitation facility. Now, if somebody's had a major medical event like a stroke, traumatic brain injury, spinal cord injury, an amputation, they would be naturally transitioned to an acute care hospital where they receive intensive rehabilitation, at least twice a day, from physical therapy, occupational therapy, psychologists, physicians, nursing staff, speech, and a host of the therapies that are essential for coming around that person to identify the deficits in their life and develop plans to restore function to the best of their ability so that that person can go home and maximize their quality of life in a safe manner. Now, it's not uncommon today for people to be, living their lives but still have deficits. And we see that in people that are limping from a osteoarthritic joint. We see people that have had minor strokes and never accomplished or fulfilled rehabilitation sufficiently with occupational or physical therapy. Even people with medical conditions that lead to deconditioning would benefit from a rehabilitation. And so that's why I laughed at the beginning and said more of us may need rehabilitation than we realize, because if we can intervene when something starts, you start limping or you start with a mild deficit or deconditioning or weakness in one leg or one side of the body, and begin exercising and stabilizing and rebalancing and realigning the body at that point, we can prevent more significant consequences down the road. And so, one of the general concepts I think I'd like to leave the audience with today is that, this is, rehabilitation and therapy are not reserved just for significant events, but they can really be utilized to not only improve the quality of your life, but prevent something from getting worse or becoming more complicated, where it's not an easy solution down the road.
That's interesting. And as I'm listening to your comments, I'm thinking about the patients I'm seeing daily coming through my clinic, and people who are deconditioned. They have diabetes, they have heart failure, they have arthritis. Maybe they've been discharged from the hospital and maybe they're up and on their feet. But perhaps I may need to be more aggressive in getting a physical therapy consult or rehab evaluation just to get an assessment on those patients. Frequently I'll have patients, that come in with walkers, and I'll say, well, let me see how well you walk. I may move the walker in front of them 2 steps, have them 2 steps with people behind them, see what their balance and gait is. But, it's interesting that you mentioned that, because most of us, certainly in clinical medicine, only think of physical rehab needs from the standpoint of a clinical medical event, stroke, heart attack, prolonged bed rest, etc. But I think the point you raise is on point. And I think, people with, debilitation, arthritis, through whatever means, who are mostly sedentary, they perhaps may need to be evaluated, because oftentimes they're losing their core muscle strength and their balance and their gait, and then they become risk for falls over a period of a few days or weeks, and we don't realize that.
Yeah.
That's really point on. Now, share with us some of the science behind physical rehab, some of the data that, let's say, in a perhaps an elevator pitch discussion, you can share with the audience.
Yeah, absolutely. And I want to just step back 1 second before I jump into some data, because you made
Sure.
such a great point about, the importance of preventing some of these issues like falls. And what people don't realize is that, because we're sitting all the time, our hip flexors in the front here get tight, and it tends to shift our body forward. And so now, because we have tight hip flexors and a weak core, and we haven't exercised our quads, we are, leaning forward, and then you catch a toe. You don't have enough strength in your quadricep to catch yourself. Your center of gravity is already over your toes, and it's very easy to fall. And so, a little bit of stretching, some strengthening, focusing on the quads can prevent a life-altering injury. And so you're absolutely right. Intervening at that point is really essential and can dramatically change someone's outcome and health span down the road.
Wow, that's amazing. That's some technical information there that I think we can all grab a hold of. So you were going to help us with some of the science behind physical rehab and some basic data points that you can share with the audience.
Yeah, absolutely. When we look at the data, and it's kind of it's a broad amount of data here because we're looking at spinal cord, brain injury, amputee, musculoskeletal medicine, but just very generally, the patients that are engaged in active rehabilitation programs with a team-based approach have much higher outcomes, have much higher quality of life, have fewer complications, fewer hospitalizations, and they go on to live a life that is much higher quality than those that do not. And also, one of the interesting data points in kind of this entire area is that the people that are engaged in an active rehabilitation program have improved mood, lower depression scores, lower suicide
Mm.
rates, because they've regained some hope. They've
Wow.
One of the real benefits, I think, of the approach of physical medicine rehabilitation and a rehabilitative program is to dramatically shift your hopelessness into hope, because now you see that you've regained function.
Huh.
And it's not uncommon for people to return back to work, return back to meaningful activities like driving cars and participating in life. And on the musculoskeletal side, we see dramatic improvements in reduction in falls, pain scores. And, pain is like one of the leading causes of disability globally,
Mm.
musculoskeletal pain. And so anything we can do to intervene and reduce pain by realigning the body, regenerating tissue through some regenerative injections, stretching, rebalancing, can incredibly change someone's life. We can get them off opioid medications. We can stop NSAID medications. We can prevent surgeries if we catch it early enough. And
Wow.
so, that element of intervening early with rehabilitation in a musculoskeletal condition, can alter the course. And as you and I both know, I'll finish with this, Dexter. When somebody has pain,
Mhm.
they eat very differently than if they don't have pain.
Oh, wow.
And when they have pain, they're much more likely to eat those foods that give you a little bit of a hit: sugar, fat, and salt.
Oh, wow.
And in fact, sugar not only works on the dopamine reward system, but it works on the opioid reward system, opioids being
Wow.
pain
Yes.
medication. So,
Uh-huh.
you satiate your pain and depression with food, but it only causes more inflammation everywhere in your body: heart disease, type 2 diabetes, and joint pain, and things get worse and it spirals out of control.
That's a great information. First, I want to give a thank you to that's Ms. Rivers for the donation there. Much appreciated. Thank you very much. Thanks for the support of the channel. But you hit a couple of points there, but related to the depression and anxiety, do you think? I mean, the mere act of physical therapy, the action, are they increasing endorphin levels with that amount of rehab? Is there any data suggesting that something along the lines of the runner's high is that contributing to it as well?
Yeah, absolutely, Dexter. You are spot on. When somebody is exercising, moving their body, beginning to, enter into physical and occupational therapy, it has that impact of stimulating endorphins. And it also has the impact of stimulating brain-derived neurotrophic factor, BDNF,
Mhm.
which builds new brain cells. And so part of this rehabilitation process, of exercising your brain and your body, creates a regenerative milieu inside. It's an environment inside your body that can also activate the restoration of cells. And my vision for all of this has always been, like you, we take the benefits of rehabilitation and exercise and good sleep and stress reduction, and we pair it with a really healthy, nutrient-rich diet, whole food, plant-based diet. And then everything is working towards that rehabilitation process where you get the maximal restoration of cells all throughout your body.
Wow, that's very powerful. There are some questions in the chat there, and actually one plays along the lines of one of our talking points. I'm going to get to that one last. The second to the last question I'll ask is, and you really touched upon this before, but just hit it with some bullet points. And how can someone optimize their health baseline to improve their chance of recovering from an injury? And I think you've sort of covered that, but I just want to hit the direct question, hit it with those direct bullet points to recap.
Yeah, thank you for your question. That is the right question. I love when people ask the right question. And this question applies to like anything, any injury from an ankle to a stroke. But one of the most important things is that we don't ignore symptoms or pain, because it's really our body just telling us that something needs to be addressed. And so often today in the kind of rehabilitation and pain world, we like to cover up that message of pain with medications or something else, rather than saying, well, why is the pain there? What's it telling me? And we make the mistake of kind of reducing things down to, for instance, I have a knee problem, so therefore I'm just going to inject my knee with cortisone, rather than saying, why do I have a knee problem? Did it start with a foot issue? Is my body out of balance? Do I have a leg that's too long? So the first step is just simply to ask, why did this occur? To try and find the root, because if we can go back to the root, we can not only work to correct the current problem, but we can prevent it from recurring. Wow. So the first is just to ask, what's the root cause? How did this happen? And sometimes you may need the help of a professional to find that, but that's a really important question. The second is, and you and I both believe this is true, Baxter, the food is the foundation. You've got to get the diet right. You can exercise, you can do all these other things, but if your food's not right, your body won't heal. So you've got to load your plate up with whole plant foods. It is essential. Exercise and activity are important, but if you're trying to recover from an issue or a problem or a pain, stroke, musculoskeletal pain, it's really good to start with a therapist who can give a professional evaluation, or a functional fitness professional who understands how the body's connected. And they can evaluate, find the weak areas, the deficits, the things that are too tight, some things that might be too loose. And they can begin working to bring balance and restoration to the body through kind of a dedicated program that's built just for you. I really think that's essential, because I've seen so many people that will go to the gym, try to rehabilitate themselves, and end up hurting themselves, but because they didn't understand that, one area of their body needed more attention, less weight, more stretching than the other area. So working with a professional is really essential, to just get the eyes of someone else to understand where there's a misalignment, where there's weakness that needs to be rebalanced.
Wow.
You've got to sleep. All the evidence on sleep is that your body goes into a regenerative mode when you're asleep. And if you don't get a good night's sleep between 11 and 6, you miss that regenerative opportunity. And so you've got to get some sleep. And then, like you and I both know, Baxter, you got to let go of some stress as well, and trust and hope in a better future.
Wow, that's amazing. Last question. Someone raised it in the chat. This whole issue of pickleball. As you know, there's a report of Jamie Foxx having played pickleball. And what do you make of that? I mean, how do you fit that in the context? We have the earlier reports. Now we don't know that some people mentioned in the chat, what happened. I want to state up front, neither of us are part of his treating team, and we're not violating HIPAA. We're not, bringing any information. What we're doing is we're taking the information that's being reported, and we're having a broader discussion on that information, and in hopes that people will learn from that, from the general standpoint. But I'm sure in due time the information on Jamie Foxx would come out. But there was a report of him having been playing pickleball a couple of days, reported by his daughter. How do you fit that into this whole picture?
There's a lot of gaps, right? We just don't know. But it's not uncommon in rehabilitation to use sporting activities as part of a rehabilitation process. So it's possible that they're working, to get him moving on the pickleball court. There's a lot of things we don't know, and we don't know at what level he's playing pickleball.
Okay.
Somebody with a stroke, this may not be Jamie, but somebody with a stroke could go out and as they're recovering, just work on hitting balls over the net or just moving on the court.
Yes.
There's another interesting hospital, St. Joe's in Michigan, where they have a farm on the hospital grounds, and they use the farm as part of the rehabilitation process. So patients go to physical therapy and occupational therapy in their hoop house, and they're planting, harvesting, they're working as a farmer as a part of their rehabilitation process.
Wow.
And so, it's not beyond the realm of possibility that he's out on the pickleball court as a part of his rehabilitation.
Wow. This has been amazing, Scott. We're going to have more of these conversations. I've learned so much, and so much of this is applicable to the many acts of, points in life, whether you're recovering from an injury or a medical condition, or whether you are planning to become a weekend warrior. And we're going to have to bring you on again to talk about some of the issues related to our Heart and Soul of a Champion ongoing docu-series as we look at some of the athletes and some of the regular people who are going out working out. So this is truly a gift. Thank you very much, and I really appreciate everything you've done today, and I'm sure our audience has appreciated it. And this is going to go a long way to educate the public about getting their bodies physically, not only just physically fit, but physically right. And something as simple as knowing is just sitting in a chair all day can promote disability, I think says a lot. And for those, because again, most of us say, well, I'm just working and I'm doing my daily activities, but our sedentary lifestyles are promoting a state of disability, and we need to be conscious of that. And that's one. Two, then we need to start to integrate things in our lives to counter that, certain exercises and rehabs. And those of us who are going to become weekend warriors, I'm thinking about myself, probably should get an evaluation periodically to evaluate our weaknesses and strengths so that we can not worsen injury. So I'm walking away with a lot of this, and hopefully our general public will as well. Thank you very much. I'm going to close out. I'll see you backstage, but I really appreciate everything you've done and your wonderful comments. Everybody, please, again, give us a thumbs up. Subscribe if you're new to the channel. Share this with anyone and everyone. And, of course, hit the notification button. Thank you again, Scott. I'll see you backstage.
Thanks, Baxter.
Okay, there you have it. Another show. And, again, I learned a lot from this. And those of you who came in late, you really should go back and hear the recording from the beginning. Scott really outlined some important things. I want to reiterate the fact that we don't have specific information on Jamie Foxx's condition, but I'm elated to know that some of the news coming out now is much more positive. And we certainly hope that he was playing pickleball at some level and that he's recovering. But more importantly, or as importantly, I should say, I really hope that you're gaining information from these presentations that in a way that you can apply it to your lives and improve your overall well-being, because that's the purpose of this, is to get your attention based on the headlines, but not just stop there, to give you insight in terms of what you can do to improve your overall life. So if you got something for this show and you really enjoyed it, again, hit the thumbs up button, subscribe, hit the notification, and please share it with anyone and everyone. And until next time, take care.